Good afternoon on this Wednesday afternoon. I'm Karen Lehr with Idaho News 6, and we are broadcasting live on Facebook for our Safely Back to School series. This conversation today is going to include some experts from across our region, and we're focusing this conversation on children that are at young child care age, preschool and younger, and how to get them safely back to school. So I'll bring in our participants here one at a time, first starting with Martin Baldwin with the Idaho Association for the Education of Young Children. Martin, if you could just tell us a little about what your organization does and your experience with kids in this age range.
Thanks. Yeah. Idaho Association for the Education of Young Children, at our core, we're a membership organization. Our membership is built up of early learning professionals who serve children and families anywhere from age 0 to 3rd grade. We have advocated for years for increased investments in high quality early learning, high quality childcare, and we offer support for families in that area. So we're excited to be here today to talk about some of the issues facing this sector. Thank you.
All right, thank you for being with us, Martin. And next on our panel of local experts here, we also have Lori Facilla with Giraffe Laugh. Lori, if you could tell us about your organization and your experience.
Hi, Karen. Thanks so much for having us. I'm Lori Facilla. I'm the Executive Director of Giraffe Laugh Early Learning Centers, and we've been in the Valley for about 30 years. And we care for about 200 children every year that are 5 and under in one of our 4 programs. So we spend a lot of time in this space, and we're anxious to let you know what's going on in the early childhood field.
All right, a lot of changes there. We look forward to hearing about that. Thank you for being with us, Lori. And then our third panelist this afternoon joining us is Dr. Jim Polo with Regence BlueShield, and you have a lot of experience as well working with young children, right?
Yes, Karen, thank you very much for including me as well. My name is Dr. Jim Polo. I am with Regence BlueShield here in Idaho. I'm a child and adolescent psychiatrist as well as a psychiatrist, and so I lead our efforts to make sure that all of the members that we cover have adequate coverage for their emotional and mental health type needs. And as you might imagine with COVID, there's lots of stress going on, particularly in kids.
Absolutely. A lot of changes in all of your fields going on right now, and we're going to talk about that coming up. But just to get things started, we want to talk about the importance of childcare. So Lori, this first question is going to be for you. We have seen, a lot of people these last few months getting the opportunity to work from home when they have not been able to previously, myself included. But for a lot of job fields, that is just not possible. And people need somewhere safe to keep their kids while they are working. So what do you think the role of childcare plays in rebounding our economy as a whole?
Well, I think we're the most critical piece of the puzzle, really, to Idaho's recovery. We're frontline workers. There's no way that so many other essential and non-essential employees can go back to work without us. And Idaho's workforce consists of a lot of families with children under 5. And if they don't have childcare or limited options because childcares are closing or whatever the case may be, really and truly only affluent families have access to quality care outside of the home. So our concern is really for families of low and moderate income households. It's a bigger issue. They don't have the resources, and oftentimes those people are the ones that are essential workers that we're relying on right now to help us with our basic needs during a pandemic. So I would just emphasize that childcare is the foundation for the ability of all of our other sectors to go back to work.
Yeah, it's putting a lot of parents, in a difficult situation right now, especially in a lot of childcare facilities have closed their doors. So Martin, the next question is for you. What are you seeing and hearing from Idaho childcare facilities in our area and their abilities to stay open during this time?
Yeah, I would echo what Lori has said in terms of, we view childcare as the backbone of the workforce and the economy. And it was a challenge before COVID, but certainly COVID has exposed some very serious issues with our system and challenges for parents and childcare providers that didn't have as much, time on the forefront of our minds as they maybe did before. We have a lot of childcare operations across the state that are really experiencing what, I would say is a revenue roller coaster. They're, before this crisis, we're already operating on extremely thin margins, and a combination of parents who either are out of work or temporarily home from work and keeping their children home for health and safety concerns, the variety of reasoning there. Through a combination of that and folks who can't afford childcare anymore due to their economic condition, we're seeing those ramifications are echoing through the childcare community, because they were on very thin margins before this. And if you are losing enrollment when you're already keeping things pretty tight, you're going to end up in a place where you're making some impossible decisions between health, safety, quality, and financial solvency. So we're seeing some pretty tough things out in the childcare community, both through the providers and the families.
And I wanted to cite some numbers from a recent national survey that you shared with me prior to this conversation that found 86% of the respondents there are serving fewer children now than they were before the pandemic. Enrollment down by 67%. And without significant financial support, only 18% of these programs are expected to survive longer than a year, which based on that would be 41 out of 50 childcare facilities closing their doors. So what do you, from a professional standpoint, see needing to be done to be able to ensure that childcare facilities can exist beyond 2021?
Yeah, the core of this for us is the stabilization of revenue. And the best way that I can really highlight in parents and childcare providers and folks involved in these systems have been well aware of these issues for years through their participation in them. But for folks who really haven't had a child in childcare or been up to speed with folks who've been in these systems, I describe it as this birth through 5 childcare system that we have in Idaho is just as essential and just as vital as the systems that we have surrounding K through 12, but without a dedicated funding stream and without a lot of dedicated infrastructure to support it. And so all these struggles that we're seeing, for example, in the K through 12 with the strain and the difficulties that they're having put forward to them by reopening, we're seeing that all across the childcare sector as well. But there's also a lack of sustained infrastructure to help them deal with it. So we're really looking at some critical pieces here to make sure that different forms of aid come in to support the childcare providers in these times. That's both workforce related, personal protection equipment related. And we're certainly hugely supportive of the state funds and the federal funds that have come in to offer relief. And we're hugely supportive of that money moving quickly and being flexible for providers to use it for what they see fit to keep their revenue streams consistent, so that they're not in a position to make the tough call to close.
Yeah, which a lot of facilities have made. We are getting several comments from our viewers right now. Kim says their YMCA is doing a great job. That's great to hear. Stacy expressing that kids shouldn't be going back to school right now. It's not safe. And I want to pull in a question from Adriana Anderson right now that says, how will daycares compensate for if schools have rolling closures? It's expensive, and often daycares already have waiting lists. So if any of you want to jump in and maybe help answer that question.
Yeah, I mean, I would say the difficult answer to that question is we don't know. There are a lot of really difficult considerations that our childcare providers are being forced to make when it comes to this. If schools are closing, they are being put in a position to take on a lot of the school-age children who are coming through the doors. This brings into question, the health and safety of whether or not the virus has been spreading in those environments, and how much that calls into question, the ability to provide a safe environment. So we're struggling with that as well. And in terms of room and space, those fluctuations of enrollment are really dramatically very difficult for childcare providers to take on. And the lack of stability and assuredness that they have some consistency in this is really posing a lot of challenges. I'm sure Lori has firsthand experience dealing with this.
Lori,
do.
did you want to chime in? Yeah.
Sure. We have a school age program that is just pop up during the summer, and we won't be able to continue that during the fall. And there's a lot of centers that are like that only have temporary summer programs that they plan on doing, and then they close those down during the school year. So I think it is going to be a big issue for parents, because currently there's so many children that are in childcare during the summer, and what are they going to do if schools don't open?
I wanted to bring you into the conversation, Dr. Polo. We spoke last week about this, and you had expressed, of course, there's the aspect of the convenience for the parent to have the childcare, but it also provides the child with a lot as far as, mental health and social skills and development. So from a medical standpoint, where do you see the role of childcare playing?
Yeah, first of all, that's a great question. First of all, I agree with everything that has been said so far. The child development that occurs in any kind of childcare setting is really critical, particularly for those kids under the age of 5. And from my perspective, it's critical for us to recognize that when you disrupt that child care process for a child, whether they're attending a child care center or whether they're even getting child care taken care of in a private setting, even within their own home. But when you disrupt that, you potentially disrupt a child's development. And so in addition to impacting kids, this will also impact adults. Adults really tend to feel better when they know that their kids are being taken care of. We have a lot of parents that are hardworking that need childcare services, not only so that they can go to work and not be stressed, but so that their kids can be exposed to all of those things that help them grow and develop in the context of being around other kids. Critically important. And so I do worry about not only the physical health of kids, because I think one of your comments was that people are afraid that it's unsafe for kids from a medical perspective. That's actually not totally accurate, because it's also harmful for kids to be locked away and taken away from the environment where they can learn and emotionally interact with other kids.
Then on that note, let's jump into the topic of what precautions we are taking to make it more safe for children to be in the classroom at this age. So, Martin, when it comes to childcare facilities here in the state of Idaho, what sanitation guidelines are being mandated from the state? What's being suggested? And what is up to each individual facility to kind of make the decision on their own to change practices?
Yeah, so I think this question is good because it highlights a really central challenge that childcare providers are facing, in that there is a desire for some more clarity on official guidance as to what is mandated and how to enforce those guidelines in a realistic and manageable way. There's a ton of recommendations, and differing recommendations made from differing levels of authority, whether that be our local health districts or from the top at the governor's office, where the advice is given on how to approach this. There's a lot of things being put towards the providers that they're having to sort through right now. Too many to really list in this call, but a few, examples of this are processes for being in touch with parents and staff, and steps to keep everyone updated on what is going on in the event of an exposure, and coming up with individual facility preparedness plans for them to hone in on how to actually approach this if there is a potential exposure. And a lot of folks are dealing with that in different ways. There's a modification of drop-off and pickup procedures, taking children's temperature upon arrival and staggering arrival times and drop-off times, in pickup times as well, ensuring mask policies of parents as they enter the building, and potentially even for the providers as they deliver care throughout the day, which offers its own challenges. Let's remember these childcare providers are taking care of very young children who are early in their developmental stages. And so the safety that comes with masks often comes with the expense of children not being able to pick up on facial cues and social cues that they would otherwise be in a position to be at a critical developmental stage to learn. There's a lot of stuff to consider, and for every rule or every recommendation, there's an extra nuance for these providers to really think about when it comes to the developmental considerations. So there's a lot of stuff that these folks are sorting through right now, and clarity on the guidance and some ability to figure out the authority of which to enforce guidelines is, I think, a pretty critical thing we need to be thinking about right now. And Lori is living this right now. Again, I don't want to keep punting to her, but she's doing it. She's taking time out of her day to talk on this call, but when she's not doing this, she's guiding all of these processes.
Yeah. So Lori, my question for you, the video that we just saw here is, a video that was shot pre-pandemic. So it's what we would think of when we think of childcare and preschool and kids working together and sharing toys and all these sensory play toys and, working in groups, parents and teachers not wearing masks. So what has changed for you? You're kind of on the front line of this. What changes have you guys made to how class looks now for kids this age?
Well, it looks a lot different than that, but really in so many ways, not that different. I think what's really important to note that whatever providers are doing is costing more money to provide the same equal education that we were before. We have, for example, parents aren't allowed in the building, children get their temperature taken when they arrive, no one wears shoes inside. We used to do family style meals. Now all of our meals are plated and there's constant cleaning going on. And what this requires is just a lot of extra staff and a lot of extra help. So during those activities during the day, we try to have our own art supplies as much as possible, very few soft toys, a lot of stuff that we can just spray down and clean. We do have child-sized gloves for sensory play. There isn't as much sharing as we used to do, we really always encourage that, but a lot of centers have had to purchase duplicate toys and so forth so that it just isn't as much of an issue. Right. So again, that cost is just way higher, and you consider what teachers need to perform, such as masks, extra gloves, smocks, cleaning supplies, reliable thermometers, a lot going on.
It's not cheap.
No.
So on the topic of how these germs spread, Dr. Polo, I'd like to bring you in as well, talking about in the classroom setting, what does the science show about how this virus can spread from student to student at this age? Or, can a teacher or a student infect an entire classroom of kids this age?
Yeah, that's a great question, but I want to highlight first, because Martin and Lori have both touched on this. These early years, when kids are in daycare prior to entering a formal school system where they, enter as a kindergartner, these are critical years of development. Kids are very energetic. They're very interactive. They are picking up on all kinds of cues as they learn to socialize, as they learn to communicate. And so it's really important to make sure that we're still providing an environment that allows that to occur. And of course, in our desire to make sure that we're keeping kids safe from infection, we're doing some things that makes it a little bit challenging for those kids. And we have to remind ourselves that these kids need to still be kids so that they can learn and grow. Now, in terms of the science, first of all, it's pretty well established now that the main way that this virus transmits from individual to individual is from respiratory droplets that are inhaled. So in just the course of normal talking and breathing, we are expelling respiratory droplets that float around in the air. And those respiratory droplets will have the COVID virus if you are infected. So if you're infected with the COVID virus and you're just talking and breathing, those little particles are floating around in the air. And the reason why we recommend a 6-foot radius is because that's the amount of distance where more than likely, if there's not a lot of wind blowing around, if there's not a lot of air movement, those particles will eventually settle and not go outside of that radius. Now, when you have little kids that are yelling, screaming, they're running around, they're laughing, they're singing, they're playing, number one, it's harder to maintain that distance, and that distance may need to increase. Now, something that is critical, because this relates to the idea of wanting to keep the environment hygienically clean and safe. There's no question that if those particles land on a surface, that it's potential that you could actually touch that surface, get a virus particle on your fingers, touch your face, and then you could get infected. But that is not the primary way that transmission appears to occur. So it is more important to think about masking for the purposes of preventing infection spread. And of course, that's very difficult with kids, and it's very difficult with young kids, where we're not even recommending that you mask kids, under the age of 3. Hygiene is always important, keeping their hands clean, covering their mouths when they cough, and so forth. But it's very challenging for daycare centers to really keep everything pristine, because, kids touch everything very quickly in a matter of moments.
And then put them right in their mouth. Yeah.
My son says little kids are sticky. I mean, think about it. They're constantly drooling and coughing, and,
Yeah.
So this is a respiratory virus, and that's where the virus resides. And so it's more challenging with young kids than it is with adults.
And Lori, I'll ask you, you mentioned getting duplicates of some toys and having to, put the cost into additional sanitation standards and more cleaning products. What does this look like differently for the kids? Are you telling them, don't put your fingers in your mouth, don't do this, it's hard to teach that to a 2-year-old that just wants to shove it in their mouth anyways, right?
Right. So we have children 3 and above wearing masks when they're inside. So when we're in circle time or activity time, it's just great because, as everyone's mentioned, it just isn't developmentally appropriate for them to actually be separated for any amount of time. And we can't constantly be asking them to separate themselves. So it is just one more protection for them to do. And when they're eating or napping, they of course take them off, and then we spend a lot of outside time so that they can have that freedom as well. But we look at it as any other health, issue that we teach them, such as putting on sunscreen, brushing your teeth, wearing a helmet, washing your hands. Those are all health related things that children understand and adapt to so easily.
So then, moving on to the topic of how to talk to kids about this and what's going on. Dr. Polo, I would ask you, is there an age cutoff where you would recommend, maybe this is a game and we're superheroes and this is why we have to put on a mask, versus an age where, you tell them this is because of a virus, this is to protect you? Do we keep it honest from the get-go, or do you kind of recommend, is there a sweet spot there for an age?
Yeah, that's a really great question. And keep in mind that children in those early developmental years themselves are learning how to talk and communicate. So one of the challenges with masks is they're missing a cue that helps them understand what's going on. I would tell you up front that there's no real age at which I would say you definitely should not bring this up or talk with kids about it. By the same token, you need to remember that kids understand things and need to be talked to in a manner that's consistent with their age level, okay? And it's very variable. There are some 3-year-olds that are far more verbal than others, and so forth. What's important to make sure is that when a child is expressing or talking about something that might be related to COVID, this pandemic, this infection, whatever, is first to really understand what their concern is. As adults, we have different concerns. We have our own anxieties. And sometimes in our zeal to address a question, we may be missing what's really affecting a child. So for example, a 4-year-old might say, I'm afraid of COVID. And an adult might launch into a description of what COVID is. And maybe what the child is really thinking about is, well, does this mean I won't get to go to school? Which is a slightly different worry than quote, quote, being worried about COVID. So understanding what is the focus of a child and what they're worried about is most important. And then answering them honestly in ways in which they will understand. And it's okay for adults to sometimes tell a kid, I don't know that. So for example, a kid might say, what's a vaccine, or will I ever get a vaccine? And the reality is we don't know. And it's okay to say, I know. It would be better to focus kids to think about the here and now. Kids don't usually think far into the future. They're thinking about today, tonight, tomorrow, this week. Focus on the here and now to essentially give them a sense of reassurance. And then the final thing I would recommend when you're talking with kids is try to be interactive. The more that they can talk, the more likely they are going to be settled with whatever it is that you're talking about.
So rather than just talk at them, you had recommended when we spoke previously, take the time to listen and understand, what it is they're feeling and concerned about, right?
Absolutely. And parents know intuitively that sometimes you have to have the same conversation 15 times before they really understand it. So, if they ask you one day and then the very next day they seem to be struggling with the same thing, that's just the way kids are. And that's okay. And the other thing is not to rush things. It's not like you need a child to understand everything about, quote, infection all in one day. That's not helpful and that's not practical. So, we're going to be in this early period of this pandemic for a while. And I do suspect strongly we're going to have a vaccine by next year. So a lot of this is going to evolve and change. Remember, kids don't really think in that way. Their attention span is very short.
I'd like to briefly, just for those of you watching live on Facebook, continue sharing your questions in the comments. We're going to get to some of those questions here in just a few minutes. But while we're still on this topic, Dr. Polo, I wanted to ask you, kids are very intuitive and they can pick up on the feelings and emotions of their parents at home. So I want you to talk about that, maybe some things that parents can kind of keep in mind that they might not realize that they're doing at home that can then be feeding some anxiety into their children.
Oh, absolutely. So, the first thing that I would recommend is limit exposure of the media to kids. And what this really means is you also have to think about yourself as an adult. You only need about 10 minutes to know whatever is new for today. But if you're exposing a child to a lot of media, whether it's on the TV, the computer, whatever, the radio, where they're talking over and over about COVID and the latest numbers and the infection and the reproduction, all of that is overwhelming for adults and equally overwhelming for children. So the first thing is just to limit how much they're actually hearing about. Now, to your point, Karen, kids are very sensitive to the emotions of the adults around them and very sensitive to their own parents. So if parents are worried and anxious, kids will be worried and anxious. The challenge is kids won't necessarily know what the parents are actually worried about. And so it's very important as a parent to make sure that you're modulating your own response, that you're not allowing your own emotion, your own concerns, and your own fears to influence how a child might feel. Kids need to feel safe and protected. And generally, they essentially kind of have this expectation that parents are taking care of all those things for them. And so as a parent, it's very important to not let our own anxieties and fears create anxiety for their own kids.
We've got some people chiming in. Kirsten saying, yeah, don't make your kids afraid. The comment there at the bottom of the screen. So I think that's an important reminder for a lot of parents that are watching this. And Lori, you guys have some resources available online through Giraffe Laugh. I think we have that we can bring up on screen. That's kind of a pamphlet, even like a printout that parents can kind of step by step bring up some of these tough topics in a way that kids will understand. Explain some of the resources that you guys have available.
Well, you can find these on our website, on our COVID-19, on giraffelaugh.org, but there's a COVID-19 page. And the goal here is just to explain the coronavirus in such a way that a child isn't afraid and they can understand. And like Dr. Polo said, we want to be sure that we're not frightening children, but an informed person is a happy person, right? They know what's happening and things aren't as frightful. And children have picked up on this. They know something's happening. Everyone's wearing a mask. We're asking them to wear masks. So if they can talk about it with their family and their teachers and their friends very openly, it just becomes less frightening for them. This is a printable coloring book by Adrienne Presnell, and it touches on the virus, what you can do as an individual, what you can do to keep yourself and other people safe. Adults should read it too, because it's really understandable and a great resource. We also have a video from Daniel Tiger that PBS developed and who doesn't love Daniel Tiger, right? And that one you can just share with your kids. It's just how to talk to them about the coronavirus. And then the World Economic Forum also has some great information. But what it all boils down to is making it age appropriate. And I'll just mirror what Dr. Polo said, that you don't need to jump in with all of the information, kind of maybe dig a little bit deeper and find out what they're really feeling and take that and go from there and just start answering questions. But I don't think we can afford to pretend like nothing's happening and shield them. They need to know them, what's happening and what we're doing about it. So
they're picking up on all of the changes for sure. Bringing in a question on the screen here that maybe Dr. Polo, you may have some advice. This is from Heather, who says she's having some trouble getting her son to explain some of this. He's 4 years old and he has autism. Would you have any advice in this particular instance to maybe help children in that kind of setting?
Yeah. So first of all, I want to touch on something that Lori just mentioned. It is important to remember that some families have kids at different ages. And so not pushing is really important, because some kids may be a little bit more ready to talk about something or ask a question, whereas others may not. And they're both normal. So some kids will not think it's a big deal and they'll go about playing. And you don't need to worry that they should be, quote, anxious. Other kids will be a little bit anxious and might need a little bit more, talking to. And that's also normal for those kids. Now for young kids that have autism, keep in mind that one of their challenges is that they learn a little bit differently. And sometimes they don't pick up on cueing as quickly as other children do. So it's very important with kids that have those difficulties to make sure that you're modulating your ability to communicate to those kids in a way that would be appropriate for them. And you would do this with a child with autism on any issue, whether it's eating, whether it's playing with other kids, because generally kids with autism need more hand-holding in terms of communication, because they have some behavioral challenges when it comes to this. It's okay if an autistic child is asking questions also about COVID. It's also okay if they're not. They may not be asking questions because they're really worried about other stuff, and it's not something that you need to push onto a child.
And
go ahead, chime in.
Yeah, I just wanted to add to that. Heather brings up a really critical systems issue here that has confronted us through this crisis, which is that there are a lot of children in families confronting the challenge of having children with special needs who previously had access to some resources and the parents had access to some parental supports. And a lot of that stuff is at a standstill. We're in a lot of trouble in terms of confronting some of those realities about the services that existed previously to this, and vital services where children with special needs are getting one-on-one time with specialists and parents are getting supports that they need. And I think that, these aren't isolated comments just by Heather and a few other folks here. This is a system-wide issue that we have to be thinking about. We have to be dealing with empathy and compassion, because this challenge stretches across the board for all parents and families and providers. But these folks are going through a lot right now.
Yeah, let me jump in, because I think what Martin is saying is really, really critical. When it comes to kids, but adults as well, at Regence, we are maximizing the ability to figure out how we can do a better job of delivering services in light of the pandemic, whether it's through a virtual platform, whether it's through telehealth. Now, for kids, this is important, and for autistic kids, this is also critically important. So we're doing everything we can to maximize bringing those services to kids and bringing them into the home, because right now we're kind of encouraging people not to go to medical type facilities for risk that they might get infected. So I think what Martin is highlighting is critically important, because until we have a vaccine, we're going to be in this kind of intermediate period where a lot of routine, medical and clinical type services that were available are not necessarily going to be so readily available.
Of course, I wanted to just briefly mention a few things on the topic of telehealth. We actually have a half-hour special airing tonight at 6:30 on Idaho News 6 that talks all about how telehealth has expanded over the last couple of months through this pandemic. So if anybody's interested in that, I would encourage you to tune in tonight. It's going to be on air on Channel 6 at 6:30 tonight. And also those graphics, the pamphlets that we mentioned and brought up, those links are in the comment section right now from Idaho News 6. If you wanted to print that out, have it available to go over with your kids, those are there and available for you in the comments section. And I wanted to bring in a comment that we received from RJ and Kirsty. It should be on the screen here, and it's on the topic of talking with kids about what's going on. And they're saying kids won't take it seriously if we don't make a big deal about it. So how do we kind of balance this, having them take it seriously but not scare them? If any of you want to chime in on your personal experience here.
Let me chime in first, because I've dealt with this in my practice for many years. Kids learn by watching adults all the time.
Yeah.
And so, if you're telling a child that they should wear a mask, but you're not doing it yourself, they won't think it's really very important. So it's very important to really model the right behavior that you want kids to think about. If you're telling your kids that they should be washing their hands, then as an adult, you need to model that behavior. Kids are more likely to do and follow your actions than just what you tell them to do. And it's okay if they make a mistake, and it's okay if you have to tell them 5 times over. But I think as adults, the best thing that we can do is kind of model the fact that, hey, this is a difficult time where we all need to chip in and do our part, because this is really about how do we together as a community get through this period of infection.
Now, a couple of other questions. This one I have, maybe Martin, you'd be able to answer this. So when this pandemic started and the state kind of shut down, I was in the hospital having a baby. I'm not the only one. A lot of people have new babies right now, or they're first-time parents. They're navigating an already stressful situation of trying to find childcare to go back to work. I know I'm not the only one dealing with this. So what advice would you have for parents in that stage, as far as, maybe what they should be checking off of their list of requirements when they're selecting a place, as far as, maybe sanitation standards, practices they have in place? What questions should they be asking?
Yeah, congratulations, by the way.
Thank you.
I actually, my first nephew was born only a couple weeks ago. So also have a newborn in our family that my sister has brought into the world. And it is a confusing and really scary time, I think, to bring a newborn baby into the world. And whereas a lot of working families, we're again getting at exposing another sort of structural shortcoming here, in the sense that we don't have very good family leave programs for working parents in the United States. They're either limited to non-existent in most places. And so where you have little newborns coming into the world where, perhaps mom was going to take a month, 2 months, maybe 3 months, if she was lucky, off from work, you're facing some pretty difficult realities about heading back to work, and finding childcare. And I think that we all, as parents, have the highest priority is keeping our children safe. And there should be a lot of questions that parents are asking, and really discerning how seriously the health precautions are being taken in the childcare facilities that they're bringing their kids to, and also offering supports to their childcare providers and the folks that are caring for these kids to understand and be empathetic about what they're going through, and be active in finding systemic solutions to confronting this as well. But I mean, the questions you are asking are are not easy to answer because there's a lot we don't know, and there's a lot we don't know about the way that the virus affects very, very young children and the potential lasting damage. And so parents are really scared and dealing with that as well. And on this side, I think that the more information that you have, the better, and the more correct, scientifically based information that you're operating off of will put you in a better position to make the decisions that you are comfortable with for your family and for your children. And it is absolutely a huge challenge and not easy when it comes to making these types of decisions.
Of course. And now, I, like many others right now, have had the opportunity of being able to work from home, which I wasn't expecting prior to all of this. And I'm lucky enough, my mother-in-law is in the other room right now with my 4.5-month-old, but she's actually a preschool teacher. Her school is closed right now. And she's in this situation where they're trying to figure out how they're going to be back up and running in the fall if they're going to change their teaching model. And, she falls into a category that may be considered a higher risk for catching COVID-19 and for it becoming more serious. So would any of you want to weigh in at all on, how do we protect the child care providers as well that may be in a higher risk, but someone has to be in the classroom with these kids? How do we balance that?
Yeah, let me touch on that real quickly, because there is a lot of information out there, but the science is actually kind of becoming a bit clear. There's no question that kids can get this virus. Kids tend to do better. They do not have the risk factors, and the reality is that the demographics worldwide show that children in general do not have the serious adverse outcomes that adults do, particularly adults that have chronic conditions. So, to be honest, if you open a daycare center in this current environment and you have all the kids go back, I'm actually more worried about the adults that are kind of supervising and helping those children in terms of teaching them than I am about the kids themselves from a medical perspective. There's no question that there are some kids that will get sick and have some bad outcomes. That happens with chickenpox, as an example. Chickenpox is a disease that we had for many years. We didn't worry about it a whole lot. When I was a kid, somebody in the neighborhood got chickenpox. Everybody sent their kids over there so they'd all get it at once. Occasionally, a child wouldn't do well. So, the reality is, from a truly viral infective perspective, children seem to be overwhelmingly less likely to have an adverse outcome. Not the same, for example, with flu. Flu is far more challenging for a young child than COVID appears to be. So I actually worry more about adults. And until we have a vaccine, adults that do have, those higher risk categories, they're at risk for getting the infection from a child that may not even have symptoms. And that's why this is so important for all of us to be thinking about how do we all weather through this pandemic until we have a vaccine in place.
Now, when it comes to being able to spread the virus between kids, at this young age, we touched on it briefly before, but just last night, Central District Health Department, they met and they decided to expand the Ada County-wide mask mandate to also include K through 12 schools in Ada County, including, all of the teachers, all of the students, all of the staff, unless you're in a place where you can be alone and close a door and being in an office. But they did not last night expand that to cover childcare facilities, but they may bring that topic up again to readdress this if all of the kids this age should be required to wear masks. Now, Lori, I think you mentioned previously that 3 and up kids, you do have wearing masks. I'm wondering how you guys feel on the recommendation of children at this age in this classroom setting. Should they be wearing masks? Does it help? What does the science show?
Like everybody else, I'm reading all of this in real time and learning about it as we go. We're building this plane as it's flying, but it seems that masks are helpful. And going back to what you mentioned about teachers before, your mother-in-law being probably a little bit anxious about returning to work. One thing I think that makes our teachers feel better is wearing masks, washing hands frequently, following all of those protocols. And now that the children are wearing masks, I think it even gives them one more layer, so to speak, not to be too punny, but of protection from, just that spray coming out of little kids' mouths that are always coming out. And when we are outdoors, we do have those opportunities to interact and to see each other's faces and so on and so forth, and do some of that bonding in person. It is more difficult with infants because an infant can't see quite as far as an older child. So we do worry a little bit that when teachers are wearing masks while they're feeding a child or holding a child or interacting, that maybe they're not getting the same experience and the same bonding that they would otherwise. But all in all, I think we just have to go on what science is available and listen to the CDC, CDH, and do the best we can and utilize what's available to us, which are masks, hand washing, all of those things.
Now I wanted to pull in a comment that we're getting here from Julie, excuse me, that says, I own a center. We have followed the current pandemic practices for years. To date, we have not had a staff member, student, or client with any illness, which is great. They've been open through the closures and they are deemed essential workers. What plans have you guys had to put into place for if you did have a teacher? I know already the ratios are at a point where you may be in kind of a rough spot if you're without a teacher for 2 weeks, if they're quarantining or if they're waiting for test results. What kind of planning have you had to do, Lori, to plan for that?
Well, we're fortunate in that we have 4 programs, and every week since we've been open, at least one person is sitting out for one reason or another, either someone they were with over the weekend may be sick or have, tested positive or suspect they are. And so we've had to make a lot of provisions of just moving people around as little as possible because we really like to keep people in pods. But really and truly, it's a challenge for childcare providers. We have teachers that don't want to come back because it's frightening. Again, there's all of that anxiety. But we've at 2 programs, we temporarily had to shorten our hours because we could staff during those times. And then as soon as everyone's back, we can open back up to our regular hours. So it's a very hybrid approach, and there isn't one solution for any one organization.
Yeah, it's kind of tough. I'm bringing in a comment here from Kimberly, who says her husband is a frontline healthcare worker, cares for nursing homes and assisted living facilities. So how do I know my kids won't bring the virus home with them, possibly even undetected? And then he takes it with him to the vulnerable patients. They've had to be very cautious as a whole family. And a lot of families, I imagine, are dealing with situations like that work in different atmospheres with more higher risk people. Would any of you like to chime in on the families that are going through that right now?
Yeah, so let me make a comment on that. And this goes back to the idea of why it's important that everybody is doing their part. In general, when an individual becomes infected, they're actually not going to have symptoms for about 2 days. So most folks will get infected and potentially be spreading to others before they themselves realize, gee, I'm having a cough, or gee, my temperature is up, or gee, I'm feeling fatigued. That's why it's important to wear a mask, because in those first 24 to 48 hours of being infected, that mask is helping protect you from spreading it to others. So it's just as possible for a child to bring home the virus from wherever they're going, whether it's daycare or school or the boys club or the Y or whatever, as it is for an adult to bring home the virus from wherever their interactions are. And so it's important that when families are out and about, whether it's at work, whether it's in an environment where they're doing social type activities, to follow the recommendations for masking and distancing so that they minimize the likelihood that they would then bring it home.
And to kind of echo that, we have Kim chiming in her comment on the bottom of the screen there that says her kids are not scared or fearful about this, but they understand that they wear their mask to keep themselves and others safe. And she totally agrees that it's a great time to teach the community and kind of learn from others around us. So thank you, Kim, for joining the conversation there.
I just want to mention one thing real quickly. It's perfectly okay for kids not to be afraid and worried. And in fact, if your kids are not, that's actually okay. You shouldn't you shouldn't feel like they should be worried. And I'm just happy to hear that her kids are being kids.
Yeah, they understand it and they're learning from it and doing their part to keep the community safe. So we're getting a couple new comments and questions in right now. I'll pull this one onto the screen as I read it for you. Natasha is saying, what are schools going to do when there's an exposure and kids have to quarantine for 14 days? Are they going to be able to continue to learn, or are they going to fall behind? And I think a lot of centers are still trying to figure out the answer to that question, right? Lori, Martin, what are you guys seeing here?
No, this is a huge stress point for childcare providers across the state in terms of, you know, if there's an exposure and they have to close down, it's on multiple fronts affecting childcare providers pretty dramatically. You know, on one front, you've got the fiscal difficulties that this causes, that revenue roller coaster that I mentioned. You know, if a childcare provider shuts down or is obligated to shut down due to an exposure or a case for a couple weeks, you logically have parents who are asking, hey, do I still have to pay for this time? And you have parents who can't necessarily afford that and to take the time off work that requires. So it's putting providers and their clients at a difficult loggerhead. And then in addition to that, you've got to face down the reality of the workforce issue. And, you know, what are childcare providers who are directing programs going to do with staff over that 14-day period? Do they temporarily release those staff? Do the staff get paid during that time when there's no revenue coming through the door? These are all very stark, kind of dire realities that are putting this system on its heels. So these, you know, legitimate questions, and I hate to pose more questions to a question, but this is kind of the thin ice that a lot of childcare providers are looking at right now.
And we talked about earlier about, you know, what's being mandated, what's left up to everybody to figure out on their own. Is this something that you see, you know, each childcare facility is kind of trying to figure out what works for them, what they're able to do financially, what they're able to do with their hours and their staffing? Is this on a case-by-case basis?
How are you tackling it, Lori?
It truly is.
Yeah.
We have a great community of support here, really and truly, with Facebook groups and Idaho AYC, and when we get together, what we really work on doing is talking through some of these issues. What are you doing? What are you saying? What are your policies? Are you charging? Are you not? Are you paying? Are you laying people off? What are all the different parts of it that you know, lead to some sort of success down the road? So we do have a lot of support with one another, but there isn't one answer for each program, and so we're figuring it out as we go.
We've got Anne chiming in saying, you know, they have to keep paying for the daycare to hold the spot, even if the child is not going, which I imagine a lot of parents are dealing with that right now. We're also seeing a comment from Courtney, you know, questioning if these facilities should close down. If kids are not at high risk, they're wearing masks, she says they should stay open. The flu makes its rounds every year. Keep your kids home, up their vitamins, make sure their hands are washed, and, you know, we all continue going on. So thank you, Courtney, for chiming in the conversation there as well. We do appreciate the comments that are rolling in. It's hard to kind of read them all as we're having this discussion. So keep asking questions here, but I would like to, you know, offer each of you a chance to kind of give your closing thoughts to those who are watching live at home. We've been going for almost an hour now. So if you wanted to, you know, kind of wrap up the kind of key take home points that you want parents and even daycare providers to take in mind after they are finished watching this today. Martin, we'll start with you.
You know, I think the big takeaway and the message that we want to get out to folks is to really put their attention on the fact that Idaho's childcare system is a network of small and largely privately owned and operated businesses that are absolutely vital and the backbone of this economy. And the really, like, because we're adults here and we're all together, the hard truth about this is that many of these these businesses are not going to survive this crisis without help. It is causing rampant issues in the workforce, with the workforce that frankly before this was underappreciated and underpaid to begin with. And these folks are folks who have toiled away for years in a passionate field and taking care of children with compassion and care for a long time. And we really need to be thinking about ways to pull together as a community to help our childcare providers and this entire sector remain functioning. And it should be also very eminently clear that on a large systemic economic scale, there will be no return to work and no return to a functioning economy if childcare is left to languish and there are no options for families. It is essential infrastructure, just as essential as our K through 12 system and our roads and our power grid. These are the most essential structures that we have for our economy. So if business is opening and things returning to quote unquote normal is something you're concerned about, then you need to have childcare as one of your top priorities. And until we sort this out, more closures will be coming and we're going to be facing a lot more difficulty to come. So we have to stabilize childcare to save childcare. And Idaho's goal shouldn't be to simply return to the way things were before, but rather we should be looking to resolve fundamental challenges that have confronted this system for decades. And I really hope that viewers take that into consideration as we go forward.
All right. Thank you so much, Martin, for your input. We appreciate it. Lori, what would you like to add to that to kind of close things here?
Well, great job, Martin. I really appreciate everything you're saying because I know all of us are really living that right now, all of us in the sector. I think most importantly, we have razor thin margins. We do this because we love it. We're highly female owned and female run, and many females working in the field, along with the way that it affects women who need to be back into the workplace. So there's this disproportionate amount of women that are being affected by the pandemic simply because of the limits with childcare and so forth. So we would really want to just emphasize we are the biggest piece of the puzzle for economic recovery for Idaho. And in that regard, we need support. We need to be able to survive because it's going to be much easier to support the system, however fractured it is right now in Idaho, than it is to rebuild it down the road when parents really need us.
All right. Thank you, Lori, for your input there and your participation today. We really appreciate it. And then Dr. Pola, before we let you go, from a medical standpoint, working with children in psychiatry, what do you want the key takeaways to be for parents to kind of bring home to their children?
Yeah, well, first of all, I agree with what both Martin and Lori have said. There's no question that there's going to be an impact to the economy and so forth, but the world is not coming to an end. And we're going to get through this, okay? And I think what Martin said is that now is a good time for us to recognize we need to pull together, work as a community so that we can all kind of make it through this period of time. What I would say as a takeaway for parents to think about when it really comes to their kids, remember the kids are very, very resilient. They also adapt quickly. So even for the kids that are in daycare centers where the routines have changed, or for the kids that are in school where now they have to wear masks potentially this next year, for the kids that can't go to school because they're doing something online, bear in mind, they will get through that. They will get back on track. Their development will proceed. The overwhelming number of kids will do just fine. This is not going to by any means impact an entire generation of kids and suddenly make them completely dysfunctional. Kids are highly resilient.
All right. It's a good reminder there as we can kind of get caught up in all of this craziness. So I appreciate your input there to each of you for participating today, and for all of those that have been watching live on our Facebook page. If you missed part of the conversation or you tuned in late, this whole video is going to be posted on our Facebook page and on our website at the bottom of the screen there, idahonews6.com. So if there's a part of the conversation you wanted to share with someone you know or love, you can share that with them and go back and watch some previous portions of this conversation. And a reminder to those at home as well, we're going to be continuing this conversation in our Safely Back to School series for the next 2 weeks in all of our newscasts on Channel 6. And then we have 2 more of these town halls planned for next week. The next one is at the bottom of your screen there. It's going to be August 4th at 6:30 in this same format live on Facebook. That's going to be talking about older school age kids for elementary and middle and high school. And then we're doing another one on the 6th that's going to focus on colleges and universities and going back to school at that level. So we're trying to cover all of this for you guys at all different stages of parenthood and schooling. So if you have any questions or comments, feel free to always reach out to us, idahonews6.com, or you can shoot us an email to the newsroom. We always appreciate story ideas and comments and that forth from our viewers to let us know what's important to you. So we appreciate everybody who is watching live on Facebook today, and thanks to all of you. And we will see you back in a setting like this on August 4th with Michelle Edmonds.
Thank you, Karen.
Thank you.
Thank you.